Hello everyone, myself Bharat from the Department of BSc Cardiopulmonary Perfusion Care Technology. Today I am going to explain about incision and midline incision.
Hi, I am Alan and talk about transitions.
I am Mitra. I am going to speak about financial incision.
I am Manikandan, talk about chevron incision.
I am Sabhirathan and talk about Mrs. Smith's incision.
So we are going to say about incision. Basically, incision is a procedure. It is done by a surgeon to facilitate and to get the view of an operating system which we are going to operate inside the human body. So the surgeon made an incision to get three things mainly. One is accessibility, another one is extensibility, and another one is security. The incisions are made on the Langes line. The Langes line is nothing but it originated in 19th century by Langer, which he was made in a cadaver. The Langes line is simply discussed about. It is a tension line acting between two skins, which where the integrity of the skin is reduced. Making the incision on the Langes line is less blood loss and give good scar and make a surgeon to view clearly. Now I am going to explain about midline incision. Midline incision is done to the patient to get a view of internal sternotomy, which is made to view sternotomy. The advantages of the midline incision are zero blood loss, zero nerve damage, zero muscle fiber damage.
So now I am going to explain about financial incision. Phalansteal incision is a lower abdominal incision and it is 12 cm long and 5 cm above the symphysis pubis. So it is mostly used by gynecologists and urologists for the exposure of pelvic organs such as gallbladder and prostate, and it is mostly used for bladder surgery and prostate surgeries. And the advantages of this phalansteal incision is lower risk of hernia and cosmetically preferred for lower visibility of scar.
I am talking about Mrs. Smith's incision. I am going to draw. This incision have 3 points. First one, chevron. It's like a Mrs. Smith's logo. This surgery goes to liver and pancreas. This incision is a upper abdomen incision, and they are cut the visualizing liver and pancreas for surgeon visualization.
Now I will explain about chevron incision. Chevron incision, also called as root-cuff incision. It has 2 points and the bilateral subcostal incision.
I am talking about transverse incision. Transverse incision is a horizontal incision. Is commonly used in abdominal surgeries. The organs visualized are gallbladder, liver, spleen, large intestine, small intestine.
So now I am going to say about certain case studies and views. You have to find it which is the incision for them. Okay? So the patient is having an splenectomy surgery. Okay? So where is the location of spleen? It is located on the left side here. What could be the incision for this surgery? Any ideas? It is located on the, yeah, very good. So you can go for a paramedian surgery for splenectomy. Now a boy is having a lower abdominal pain. Okay? He have a severe pain. What will be the case? Very good. It is
Appendix.
appendix. Where is the appendix located here? Very good. So it is actually the appendix is a tail of a large intestine. So he is having an appendicectomy. He is having an inflammatory appendix. Okay. What will be the incision method for this appendix? Lance. Any other option? Right. Here. So the male who is having a severe prostatic pain. Okay, the male having severe prostatic pain. It shows there is an inflammation of prostate. They want to operate on the prostatic gland. What will be the incision? Phalansteal incision or joint cohale incision? Where will be the incision? Just draw the incision. Okay. The person is having an surgery on the gastric region, that is stomach. What will be the incision? Can you draw the incision? So he is having an abdominal or stomach. Okay. So the person is having a liver disorder, liver cirrhosis. They want to transplant the liver. So what will be the best incision method to go for liver surgery? Mercedes-Benz incision. Yeah, both of the incision, that is according to the case. So you can go for a